Hi everybody, Dr. Chestnut here. Just a short video about the upcoming seminar. I'm excited to see everybody again. It's obviously been a while since I've been out and about. Over the last 3 years, what have I been doing? I've really been trying to find a way to take all the evidence I've accumulated over the last couple decades and just make it completely, entirely practical. And really what I've been focusing on is how do we make sure that we do a good exam and report to make sure that people are ready to commit to a proper care plan and what is a proper care plan? I mean, it's surprising to me how many people are underserving their patients because they're not adjusting them enough, and just how ridiculous some of the viewpoints are out there in terms of the evidence about somehow that less care is better, when in fact the literature is very clear that that's not true. That probably you're lucky if 50% of people are 50% better after the first 12 visits, which I am now calling really that window to see, to look at whether or not someone's a responder. No one should be expecting that they're better, even, in 12 visits or whatever. So anyway, the whole idea of this is to say, look, what is it that patients need to believe and know, but probably believe, by the end of that report of findings, so that they are ready to commit to a proper care plan, that they see a perceived value in that. What is it that a patient has to believe or to feel that they know, and also, how do we communicate that to that patient? How do we become, just master practitioners at getting the information that's required across? What is it that someone needs to know in order to make the choice, to agree to a proper care plan so that they can get better, get their lives back? What does a doctor need to know and believe? What does the staff need to know and believe, all together to make that happen, and to create a bulletproof system? And the other thing is, what does the evidence say? So that we're not making these care plan recommendations because we think it's the best way to increase our PVA, or we think it's the best way to increase our bank account. We're making these recommendations because it's what's in the best interest of the patient. It's patient-centric. But most doctors don't even know what that is. They're still underserving their patients because they don't even realize what the literature says in terms of the importance of that proper care and that maintenance care, up into the full 12 months. And so anyway, that's really what I want to talk about. I want to just, the little bit of evidence I'm going to talk about is just laser focused on what it is to make you feel certain about making proper care recommendations, to know that you're protected in terms of, you're doing the right thing. I always say it's not about convincing people to do anything in order to be successful. It's about convincing you to do the right thing in order to be successful. But the right thing is surprisingly about much more care than most people are recommending at the moment. And then again, just the communication skills. I've got some really neat things to share about, how to do that exam, quickly and efficiently, how to get that across to the patient about what their exam findings are, those subluxation or joint dysfunction, whatever you want to call it, vertebral subluxation complex findings, so that the patient knows how to relate that to what they presented with, and how to relate correcting that to what they want. And it's pretty laser focused. So anyway, I'm looking really forward to seeing everybody again, and you will leave and you will be implementing things on Monday. Absolute certainty you'll be implementing things on Monday, that you're going to learn, and it will be increasing your compliance and your retention, and your outcomes. So anyway, looking forward to seeing everybody. Take care.